Yeah, thank you, Bill, and thank you for all your work and the work of Less Cancer in working with the Congressional Cancer Prevention Caucus as well. It's always an amazing series of events. You bring such great people together. Just want to end with a few closing remarks about cancer prevention and its importance globally. I spoke a lot about HIV-associated cancers, and I'm not going to talk too much about that, but do want to talk a little bit about the importance of cancer globally. So, cancer globally is a bigger problem than I think most people recognize. In the United States, most of us have been infected or affected by someone, a family member, a friend with cancer. And we think often of cancer as a disease that happens in rich countries. But in reality, there's 18 million cancers in 2018, and 70% of those happen in low or middle income countries. These are relatively poor countries. And indeed, with improvement in the treatment for infections and decreasing in infant mortality, cancer is becoming a leading cause of death globally. And organizations like the World Health Organization and other global leaders, along with local ministries of health, are recognizing that being able to address cancer and manage cancer in the low and middle income countries is going to be critical. And to do that, really, cancer prevention is most important. And so from the public health and global health perspective, cancer prevention is a global issue. From the scientific point of view, and this is really how I entered into global oncology, it's important to recognize that the type of cancers that people get in different parts of the world are varied based on a lot of environmental factors. We've talked a lot about environmental factors today, but infectious agents are a form of environmental factors. Globally, about a little under 20% of cancers are caused by infectious agents, but that number is much higher. In sub-Saharan Africa, a third of cancers are caused by infectious agents. And so studying cancers in parts of the world where infectious agents are driving these cancers is an important way to understand how infectious agents cause cancer, but also gives us ideas on how to prevent cancer through perhaps managing the infectious agents that cause them. The infectious agent that I was interested in, and I spent a decade at the National Cancer Institute studying, is a disease called Kaposi sarcoma. It's caused by a virus called Kaposi sarcoma herpes virus. It's the same family of viruses that causes chickenpox, and most closely related to a virus called Epstein-Barr virus that causes mononucleosis. Pretty rare in the United States, mostly affects the LGBT community. In sub-Saharan Africa, it's ubiquitous. And it's, I think, as I mentioned earlier, the leading cause of cancer and the leading cause of cancer mortality in East Africa in children through age 35. So being able to study a disease rapidly in a place like Uganda and come up with better ways to prevent and treat that disease really has what we consider reciprocal innovation. We are able to take ideas that are developed in the US and in other places in the world, evaluate them quickly in places that are very affected by a disease like Kaposi sarcoma, and have impact around the world. Additionally, when we think about treatment in low and middle income countries, we really have to be innovative. We have to come up with innovations that lead to improved ways to diagnose and treat cancers. We heard about liquid biopsies. This is a prime example of something that's much easier than current practices for detecting early cancer. And so we may be able to leapfrog what has been done for decades in the United States and come up with effective ways to prevent cancer through early diagnosis. And so we really aim at accelerating the application of these really exciting technologies in places that can most benefit from them. I also just want to bring it back to cervical cancer, which was an important topic discussed this morning. Cervical cancer prevention is an area where probably there's the greatest disparity between rich and poor countries. Cervical cancer is a leading cause of death in much of the world, and so there are various efforts to vaccinate girls and boys for HPV, but particularly girls within health packages that lead to empowerment of girls, discussions about HIV prevention and cervical cancer vaccines. And so that really leads to the possibility of a generation free of cervical cancer if done correctly. And then lastly, we can't forget that we need to have better cervical cancer screening methods. And so there's a lot of efforts to try to incorporate telemedicine, which we heard a little bit about earlier today, or novel imaging or blood test or tissue test to diagnose cervical cancer. And so there's a lot of growth in this area. As cervical cancer is a much bigger problem for people with HIV, the vast number of women with HIV are living in sub-Saharan Africa, 25 million women in sub-Saharan Africa. The women with HIV in the United States, fortunately, is a relatively small number of women, but still the lessons that we learn in sub-Saharan Africa may be important in rural parts of the United States and anywhere. So the focus on cancer prevention globally really is important for global health reasons. It's important because we can accelerate our science by looking more broadly. We learn about the various environmental causes of factor that vary around the world. And importantly, it will lead to advances for diseases that are common elsewhere but rare here, better ways to manage those diseases in the United States. So I think I want to end with that. If there are questions about global oncology, which is a relatively new field, I'd be happy to take some. No. If not, it's been a long day. Thank you, Bill.